Hello, my name is Amelia Francis. It is Saturday the 5th of October 2013. This video is meant to demonstrate my capability of doing different airway manoeuvres to patients that paramedics would encounter. These different aspects include placing a patient in the lateral position, the triple airway manoeuvre and how it differs from the sniffing position, safe insertion of an OPA and an NPA, a laryngoscopy, and providing assisted ventilation for a minimum of 15 seconds. Thanks. Okay, to place a patient in a lateral position, the inside arm is extended away from the body and the outside arm is placed across the chest. The outside leg is bent. The patient is rolled in one swift movement so that there's no curving of the spine, which could cause further spinal injury if spinal injury is already present. And now rolled onto the side like that. The reason that their head is tilted in this way is so that if they vomit in their mouth, they're not going to choke on it and ensures that their airway is clear. If a patient has a suspected spinal injury, a pillow or a towel or a rolled up blanket is placed next to their head to ensure less curving of the spine. A common error in this area of practice would be to not fully extend the inside arm, which would mean that when the patient is rolled, instead of the airway being cleared, it would be obstructed as they be face down, like this. Okay, for the triple airway manoeuvre, first you want to make sure you're seated behind the patient as opposed to on either side so that you can get a clear view into the airway. The first thing you want to do is place your thumb along the forehead of the patient to tilt their head back and place your thumb and index finger on the chin and lift the jaw up to get a good look inside their airway. Next, you want to place your thumbs along the patient's zygomatic arch and your second, third and fourth finger around the base of their mandible and protract the jaw. A common error with this would be to not put the pillow behind the patient's back, behind the patient's head, which would mean the patient's head is tilted too far back and can occlude the airway. The OPA and NPA are both used for assisted ventilation. The OPA is measured from the corner of the patient's mouth down to the corner of their jaw. A common error in using these would be measuring up one that is too large, which then wouldn't fit correctly into the patient's mouth and would go too far down their throat. The OPA is inserted first upside down, it's inserted in halfway and then twisted 180 so that it goes in the whole way. The NPA is measured from the corner of the nose down to the ear. Similar to the OPA, a common error would be measuring out one that is too long or even too short, and then it wouldn't go in the correct distance to provide ventilation. It's inserted slowly and gently into the patient's nose and twisted around until it goes all the way in. Yeah. For laryngoscopy, the laryngoscope is held in the left hand with the thumb placed on the handle of the laryngoscope. The right hand is placed on the patient's forehead. The laryngoscope is inserted into the right side of the mouth and the tongue is swept across to the left side so that the laryngoscope is in the molecular groove. You then get your body down low as you push the handle away from your body so that you can see all the way down to the vocal cords. A common error with this would be angling the laryngoscope so that it pulls upwards as if you're sort of pulling a nail out of wood, and that can push against the patient's teeth and break their teeth with the metal. Okay. To perform assisted ventilation on a patient, this mask is first placed over the patient's nose and mouth. A common error in this area would be to not have a firm enough seal around the patient's nose and mouth, meaning that air would leak out the sides and the bag wouldn't inflate all the way. The patient is to be ventilated at 12 breaths a minute, so 1 breath every 5 seconds. The oxygen is turned on, the bag is inflated, and then squeezed gently. You can tell the patient is being ventilated by the expansion of the lungs as the air goes in. As you can see, if there is not a good seal between the patient's nose and mouth and the mask, the bag does not stay ventilated. Okay, is that good enough?